Welcome to Integrative Medicine with Dr. Leland Stillman, the podcast where we explore the best of East and West, old and new, conventional and unconventional, in search of answers to medicine's toughest cases and most difficult problems. This podcast is for informational purposes only. Diagnostics and therapeutics discussed on this podcast may or may not be right for you. So talk to a qualified practitioner before taking action based on what you learn here. If you'd like to become a patient at my practice, go to stillmanmd.com to schedule a complimentary discovery call. Thank you for listening and welcome to today's episode. Hello everyone, Dr. Stillman here today. I am joined by Ryan Hughes, nurse practitioner. Ryan, thank you for joining me.
Happy to be here. Thanks for having me.
And I'd like to start by asking everyone who they are and where they're from.
I'm a nurse practitioner, formerly trained in mental health, now focused on root cause medicine, and I'm from Knoxville, Tennessee.
Awesome. Tennessee. Wonderful place. So, where were you and what was going on in your life, Ryan, when you first became sick?
I was, I think what you're talking about, as far as around the time when I got connected with you, I was working inpatient psychiatry, and then I was working virtually with you. So I was crazy busy, and I started feeling my health and purpose declining. I was dealing with gut issues, which you were helping me with, which also manifested as, skin issues, insomnia that I dealt with my whole life. I dealt with brain fog my whole life and just low energy. So that's really what I was dealing with.
How many years had those problems been going on before we met?
Probably my whole life, really. Mm-hmm. And, just kind of up and down.
Got it. Okay.
Yeah.
What had you tried already as far as finding answers to these problems?
Mainly diet and exercise. And then I got connected with a functional medicine clinic in Knoxville before I went to Naples. And they helped me deal with some gut issues and with parasites and things that helped some, but I still was having some lingering issues.
How much better were you after that initial course of treatment? Let's say on a scale of 0 to 100%, with 0 being the worst you'd ever been and 100% being where you would have liked to have been.
After the treatment in Knoxville?
Correct.
50 to 60%, maybe. Better.
That's a good improvement, right?
Yeah.
Okay. But you were still struggling with things. How bad were these issues and how much were they affecting you in your day-to-day life?
Bad enough that it was affecting my outlook and how I, were able to properly deal with and help patients. Just not sleeping, that obviously affects you in many ways. Yeah.
So it was longer to take or complete tasks at work, took more mental energy, you were more exhausted at the end of the day, I imagine, and you weren't able to be as efficient as you would have liked to have been.
You got it.
Okay. What were you concerned these problems would become if you didn't find a root cause solution to them?
I think it would just continue to escalate, and I might just be stuck in where I was at. And that's a good question. I mean, it could have just gotten worse, I guess. Right.
And of course, many people reach out to us hoping that we can help them with things that are impairing their efficiency or their performance at work. And often they say, I'm able to operate at a high enough level that no one really notices, but I don't feel like I'm at my best. And they're looking to get that extra 20, 30, 40% that they were used to 5, 10, 20 years earlier.
Yeah, I guess my main concern was just not being at my best capability to take care of my patients. That's a huge responsibility.
Right, because at a certain point, you're not just not providing the best care, or the most efficient care possible. You are missing things, making mistakes, which of course, you did not get to that level.
Right. Yeah. Absolutely.
Okay. So then what was it that you found that helped you turn the corner and recover your health?
Well, I was working with you.
Tell us what we did.
Um,
Tell me like I don't
so
even know.
that's awesome. The HTMA was awesome.
Okay.
The hair
That's
tissue mineral
that's
analysis,
the hair
individualized
tissue mineral
supplemental.
analysis. Yeah, for people who don't know.
Pretty cool. Yeah. And you know what? I didn't do that long enough. I mean, I did that maybe 6 months. So I could
Hmm.
have done it longer.
Sure.
Um, I noted, from the MSM that I did notice more mental clarity from that.
Okay.
And I noticed that helped me with my joint health as well.
Okay.
And then since working with you, I mean, before I started working with you, I was already, I was dived into functional medicine and, food as medicine and all those kind of things. But
Hmm.
I didn't understand how deep light therapy was and
Hmm.
how profound it was for your health. So once I started working with you, I really started to understand that. So light therapy helped me tremendously.
What
And
sorts
I
of
started
benefits did
incorporating
you see specifically from the light therapy that you tried?
better sleep. I mean, I'd struggled with sleep my whole life.
How big was
More
of an
consistent.
improvement did you see with that?
Pretty big improvement because at this point, I still take melatonin from time to time, but I don't have to depend on it anymore. And I mean, there was times earlier in my life I was taking like trazodone to go to sleep and even Xanax and stuff. It's crazy that I was even taking that stuff, but it is true. So not having to depend on sleep aids and just waking up feeling rested and having more consistent energy throughout the day.
So how much on a scale of 0 to 100, with 0 being where your sleep was when we started and 100 being the best possible sleep you can imagine, how much progress did light therapy alone give you in terms of your sleep quality?
30 to 40% maybe.
Great. Excellent. What else did you see improve beyond sleep quality?
Mental clarity, I think, is the most profound benefit that I've noticed.
And how
And I'm
significant
just
was the improvement there?
probably 50, 60, maybe
Okay.
50-ish.
Great. What
And,
else?
and this is, I've had some mental clarity, throughout my life, but this has been very consistent,
Great.
very
And have
consistent
you seen
and
the
consistent.
results? Sorry, what was that?
And then just consistent energy throughout the day.
How big of an improvement was the energy?
Um, 30 to 40% probably.
Okay. What other benefits have you noticed? I think you mentioned gut health.
Gut health, I would assume that it's definitely helped, but it's that's kind of hard to gauge.
Sure, because it's hard to know what's working, and in the end, it all works together. There's a lot of synergy in what we do.
Right.
But overall, from 0, where you were when we started, to 100% being where you'd like to be, where are you now?
Oh, as far as gut issues, um, maybe 90%.
Big improvement. What specific problems did you see resolve? Because GI issues is very vague, right?
Right. Well, I mean, I dealt with skin issues my whole life, eczema,
Sure.
and that
Which is
was
related to the gut, for people wondering why Ryan just pivoted there into talking about his skin when I asked him about his gut.
right, right. Yeah, manifesting the skin.
Well,
That's something I don't.
how much did your skin improve? 0 to 100%.
I mean, since childhood, it's improved a lot, but like since when we're kind of talking about in the last couple of years, um, probably about 30, 40%. I mean, I'd probably already improved 60, I mean, maybe 60%, and I'm probably close to 90, 100% now.
Great. Okay.
I don't
Excellent.
really notice any skin issues anymore, and that's something I've noticed since day one.
Fantastic. So then what were the specific GI, symptoms or complaints you had? Don't feel like you have to overshare, but just be general.
Well, I've dealt with constipation my whole life. That's
Okay.
another thing. I'm very consistent now.
Okay.
Uh, um,
Bloating, abdominal pain,
bloating, bloating. Yes, a lot of bloating.
reflux.
No, not so much. More bloating.
Okay. But bloating, constipation, any abdominal pain.
Not really.
Okay. Got it.
Intermittently, not enough to really mention.
Any other major, and did I ask you this already? What percent better are the GI issues since we started working together?
Um, um, let's see, 40 to 50% better, probably. I mean,
Got it.
I already made some
Yeah.
improvement in Knoxville. So that
Right.
probably got me really over the hump.
Any other significant improvements with what we did?
I wouldn't say significant, but I've noticed like joint pain is better.
Really? How bad was it when it was at its worst?
Not much, but I mean, just I'm so active with lifting heavy weights and playing pickleball and jiu-jitsu and all that
Yes,
stuff. So
absolutely. So that's made a big difference.
I think it's made a difference in keeping me, um, preventing me from having injuries. And then when I do have injuries, I heal pretty quickly.
Got it.
And
Okay.
if I do have pain, it subsides pretty quickly. But that's kind of hard to gauge for me, I feel like.
So overall, with 0 being where we started, where you were when we started working together, and 100% being where you'd like to be, where are you now?
Let's see. I mean, probably 95%. I mean, I'm there, basically.
Amazing. So glad to hear that. What gets the
Yeah.
credit? If you have to divvy up 100% of the credit to all the
Hmm.
different things that you did to get well, to go from can't sleep well, don't have energy, struggling with brain fog, fatigue, lack of mental clarity, memory issues, GI issues, skin issues, to where you are now, what gets the credit?
Hmm. That's a great question.
Yep. I ask it in every testimonial I take.
Yeah, that's really good. Uh, hmm. I'd say probably light therapy 50%.
That much.
Yeah. Um, HTMA is probably a good 30 to 40%.
Great.
And I could have done it longer. I'm doing it again now. And then, hmm. Let's see. I mean, I did the detox powder. I don't know, maybe 5%.
Okay.
Um, and then the MSM will say 10 to 15%.
Okay.
And then I think we're close to. I
Let's see, we
haven't
got
even done that.
50% with light therapy. We got
Yeah.
30%, let's say, with HTMA. I think I got that right. Let's say we got
Hmm.
15% with MSM. And then I think we've got 5% with the detox powder. I think that's, did I do that math right?
Hmm.
I think we're at 100% or so.
Is that 100%? The only thing
I think so.
other thing I can think of right now is the vitamin C protocol, which is I'd put another 5-10% if I've still got some percent there.
You don't have some percent left. We got to start taking it from other things. But I'm actually curious
Right.
to ask you, Ryan, because one of the other things that people will say frequently is it was the coaching and the consultative
Mm.
time that made the difference. So if you have to divvy it back up, you've got to include those two things. Because for people who don't know, we do a combination of group coaching and we do a combination of one-on-one
Right.
consults to help people. How would those factor in?
So I don't know if we did all that much coaching though for me, right?
Well, you were on the practitioner side, so we were training you. But it's the
Right.
same
So that
difference.
if you included that as coaching, then absolutely. That's actually I forgot about that portion of it. So maybe you take the light therapy down to 40%, and then yeah, you got to put the group coaching in there. That's big. That's at least 20, 30% probably.
Right. Okay.
Yeah, I think that's very important.
So maybe 40% light therapy, 20% HTMA, another maybe 5% detox powder, 15% MSM, and then 30% or something like that for the group coaching. Okay, got it.
Yes. That sounds
Any other
pretty
parting
solid.
thoughts, observations, things that have come to you as we've been talking?
I can't think of anything else. It's been a pleasure. It's been a blessing.
Good, thank you.
Working with you.
If people would like to get in touch with Ryan to find out exactly what he did, you'll notice we didn't mention any specific brands or companies. The reason for that is A, we can't make medical claims, and B, I want to keep this podcast about the content and the realities of clinical medicine and not turn it into a giant advertisement. You can get in touch with Ryan through the links in the description to this video or podcast, depending on where you're watching it or reading about it maybe. And he can give you exact information on exactly what he tried that helped him as far as brands and products. So thank you, Ryan, for joining me. Any last thoughts for people before we sign off?
Get in touch with us.
Absolutely. Yeah, we love helping people. That's why we're here. So thanks again.
Yeah,
and thank you everyone for listening. Take care. Have a great day.